Good afternoon, everyone. We will get started here in just a second, but before we do, I wanted to introduce myself. My name is Mariah. I'm with the Office of Rural Health, or the Center for Rural Health, and welcome to the State Office of Rural Health webinar. As we get started, the audience will be muted throughout the presentation, but please use the chat for any questions or clarification. We'll be looking at it throughout and then answering questions at the end as well. We respectfully acknowledge that the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the Odom and the Yaqui. The university strives to build sustainable relationships with sovereign Native nations and Indigenous communities throughout education offerings, partnerships, and community service. Again, the webinar, you will be muted during it, but please use that chat for any questions. And with that, I will hand it over to our lovely host.
Thanks so much, Mariah. Hi, everyone. My name is Michelle Mora, and I'm the program manager for the Rural Health Resiliency program at Microsoft Philanthropies. And it's my pleasure to share this information with you here today. Thank you, Mariah, for the invitation. We're going to go ahead and get started. Again, if you have questions throughout, please use the chat function and we'll save some time at the end to address questions. So, this program that I'm sharing with you today is part of a broader investment that Microsoft has made for many years in supporting rural areas in the US. You may have or may not have heard about different programs such as Airband, which provides broadband internet access to remote areas, TechSpark, which provides training and jobs and connection to digital jobs. AI skilling is sort of the newer piece to the puzzle that's tying together connecting folks with jobs in the new AI economy. And then specifically, what I'm here to share with you today is the Rural Health Resiliency piece. And so that's really made up of two parts. One is the cybersecurity program for rural hospitals, and the other is the newer piece, which is about AI innovation for rural health specifically. And this program came about almost a year ago in June of last year. And it came about because the White House actually came to tech companies and said, hey, we have a national security issue with hospitals in general, but especially rural hospitals getting hit with cyber attacks. And the impacts of those are dire in rural communities, especially as you probably are well aware. If one hospital goes down and the nearest one is a ways away, it can really impact health outcomes. And so the government said, hey, how can we all collaborate to help support cybersecurity and kind of fortifying our rural hospitals more? And so Microsoft put together this program. And like I said, it started sort of as a cybersecurity effort, but we're evolving it and adding some new elements to it as well around AI and just thinking more holistically about how can Microsoft support those unique challenges in rural health using all the tools that are at our disposal in a large company. And this program is part of Microsoft Philanthropies. So it's one arm of the company that's specifically supporting 400,000 nonprofits globally. And as part of this program, it kind of carves out rural hospitals as a segment that we are treating similarly to nonprofit customers and providing a lot of free and discounted services to support you. And I'll go into a lot more depth in that in a second. But really, why is this an issue? So as you probably are aware, the healthcare landscape has a lot of cyber risks for a number of reasons. It's one of the top 3 industries impacted by cybersecurity attacks. And you may have heard about the Change Healthcare hack back last year that affected over 100 million records. So basically everyone in the US's records have been affected by this. And they are estimating that 70% of the US population's medical records have been exposed or compromised in 2024. It's probably higher than that, but it's it's just astounding the level of impact that this is having. And again, as you know, if a rural hospital goes down and someone has to drive an additional hour, 2 hours in some cases to get to a hospital, that just does not bode well for the outcome of that patient. And so the stakes are really high. And 80% of these attacks are actually just due to human error. It's clicking a malicious link in an email, or leaving your computer unlocked and someone being able to access it. So it's most of the attacks are things that are fairly simple to prevent, but are just so common that it has huge impact. And this is a great slide sort of illustrating um, the interconnectivity between all of the different healthcare systems that you use on a daily basis, between the patient tracking, billing, all of the systems are talking to each other and connected. And of course, bad people know this as well, and they know that there are certain vulnerabilities that if they are able to expose, they can get into the entire network. This slide, by the way, is from John Regi of the American Hospital Association. He's the National Director of Cybersecurity and Risk, and he said we could share this slide because we just thought it was a perfect illustration of what could possibly go wrong if someone got into a healthcare system. And really, cybersecurity is not just an issue for IT or in the IT world. It has real world implications. In 2020, there was a cyber attack on a large academic health system. So this was opening a malicious email attachment, and it ended up impacting 5,000 devices, 1,300 servers, led to a loss of revenue of $63 million. And, this is just opening a malicious email attachment. Um, and then, victims of medical identity theft, the average cost to recover for that person is 13,500. So, it's got high stakes. It's really, really expensive when something goes wrong. And so, our objective here is just to help hospitals as much as possible to prevent any issues from occurring. And so how are we doing that? These are the three pillars of the cybersecurity program. And so these are available to all rural hospitals in the US. And again, this was the White House coming to Microsoft and Google. And we partnered with the American Hospital Association and the National Rural Health Association to come up with a solution and partnerships to get the word out for all rural hospitals to know that these resources are available to you now. So the first part is we're offering free cybersecurity assessments. So Microsoft is covering the cost. We've got 2 partners that actually implement this. And what happens is you have a 90-minute call with them and you answer a checklist of items about your cybersecurity infrastructure, and they will review that, follow up with any questions, and provide you ultimately with a free report. And in that report is identifying any vulnerabilities that you have and recommendations on how to mitigate those risks. They're all anchored in the health sector best practices and the cyber performance goals. And again, this is a high level assessment. It's not the HIPAA testing. It is a 90-minute broad look at all of your systems and a free guide on recommendations for your hospital. The second piece is around training. So as I mentioned earlier, the main vulnerabilities come about with really anyone in the hospital clicking on a link. It's one of the main ways bad actors get into your system. And so training can go a really long way to help prevent those things. And Microsoft owns LinkedIn, so we have access to a ton of different training materials. And we've curated 2 free training pathways. One is geared towards frontline workers, and one is more geared towards IT staff. in security and compliance roles. That first one is really high level. It's on our Microsoft Learn platform, and it's just like high level basic cybersecurity hygiene that you can use. You can put it in your email communications to staff. You could add it to your LMS and just spread it any way that you can. The second piece is that it's cyber certification for IT staff. So if you have staff that are more technical and they can go through this free 5.5 hour training on LinkedIn, and it's more in depth, it's a little bit more technical, and at the end they get a little certificate that populates on their LinkedIn account that they completed this. So just an added incentive to complete the full training course. And then finally is affordability. So we know that cost is the biggest inhibitor of getting access to more advanced security tools, especially for rural hospitals. And so we've carved out, basically we're making independent critical access in rural emergency hospitals have access now to nonprofit pricing. So nonprofit pricing at Microsoft is anywhere from 60 to 75% off of the commercial price on most of the common Microsoft products. So if you're using Microsoft 365 for your hospital system and you have Teams and Microsoft Word, blah, 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 that's going to be a huge discount. Now, this is only for independent, so not in a healthcare system, critical access in rural emergency hospitals. For all other hospitals that are rural, you have access to advanced E5 security for free for 1 year. So it's basically 20% off for over 5 years. And that ends in June. So if you're interested in that, please, I would start that very soon. And then finally, this is a free to all rural hospitals. Windows 10 is sunsetting in October of this year. And so the security support is sunsetting with it. However, we know that a lot of organizations do not have the funds to continue to upgrade all of their devices at once to Windows 11. And so we're making it free for an additional year of extended security support. So basically, you can continue running your Windows 10 devices for an additional year, and we'll provide this extended support for free. And this will be available in September ahead of the October sunset, and then it will support the devices through October of 2026. So all of these are tools that we're pulling forward to try to support you in your cybersecurity posture. And if you're interested in this, I invite you to register on our website, which I'll share in the chat, and would love to get you connected to those things. And please, as I'm talking, if you have questions, shoot them in the chat and I can try to answer them as we go too. This is an example of one of the risk assessments that our partner provides you. So you'll see, there'll be findings along the left with recommended activities and a suggested roadmap of how to remediate those risks. It's much more in depth than this, but this is just to give you an idea. And this is an example of the training materials. As soon as you register, you'll receive an email with all of the different tools and resources that your hospital specifically is eligible for, including this free training material. On the left, you'll see this is the flyer, and in the middle there is a link to that training pathway for all frontline workers, and on the bottom is the IT specific track. And these are in the yellow box, you'll see just some examples of the nonprofit pricing products that are covered. Most hospitals use Microsoft products, so this can take a huge chunk of your budget away and be able to invest it in nursing staff or any other resources that your hospital needs. All right, so that's sort of the cybersecurity piece of it. I see a question here in the chat. Do you need the critical access designation to qualify for the free training and assessment? No. Great question. A lot of questions on eligibility come up. So we're anchoring to the CMS data. So if you're considered a hospital in the US, you are eligible. What does that mean? You're eligible for the free assessment, free training, free Windows 10, ESU, and, and then separately, if you are an independent critical access and rural emergency hospital, you also get that nonprofit pricing. If not, then you have access to that E5 1 year free. So yes, great question. We do have a data set that we anchor on. As you know, like the government data is a little messy and kind of hard to use. And we found a great tool that we use to reference eligibility from CMS. Excuse me. And I can put that in the chat here in a second as well. It's called CHQPR, and they pull the data from CMS, and it makes it really easy to look up the name of your hospital and see, what your designation is if you're not sure. Great question. Thank you. All right. I'm going to keep going, but feel free to drop more questions. Okay. The next part, I want to give you a glimpse into some of the AI work that we're doing. This is the newer part of the program, and we expect to continue building this out a little bit more. Oh, and that photo that was generated by Copilot that when we put in rural hospital. So you tell me if that's accurate, but it's kind of a fun picture. Okay, so obviously AI is becoming a huge topic, and it's just going to fundamentally change society. I mean, so far what we're seeing is that generative AI, it learns from existing information to create new content, and you see the rate of change here on the right and how steep a slope generative AI has compared to the internet or personal computers that we know have made such an impact in our lives already. So just imagine AI. OpenAI and DeepSeek are organizations that are developing those AI models. And then Microsoft, our tool is called Copilot. ChatGPT is the competitor. It's similar. So those are tools that integrate AI to enhance productivity tools. And so, the growth is just unprecedented. It obviously has potential to make a huge difference in all sectors of the economy, including in healthcare. And we're getting a lot of questions about how can we use AI better. So we created a rural health AI lab, which we're calling RAIL. And really what we did is we took about 10 rural hospital CIOs from different places in the country, different types of organizations, and we brought them together with another Microsoft partner who creates technology. And we said, okay, what are the biggest pain points for rural hospitals? And what is a very specific use case that we can develop a low code, easy to use AI tool to solve? And so pretty quickly, everyone sort of agreed that one of the big issues is insurance denials, and that just threatening a lot of revenue for the organization. And hospitals spend almost $20 billion annually appealing denials. And so that just is such a burden, both administratively and financially, on the organization. So how can we use AI? We know the insurance companies are using it. How can we create a tool that's really easy and free for rural hospitals? And so super excited to share that we have a new tool, and it's going to be available for free to everyone, but we're specifically sharing this with rural hospitals. And it's going to be a code available on GitHub where you'll be able to download it and use it on your internal computer systems. So it's not sharing information externally. There's no privacy risk in that sense. But basically, what it does, and there's a little video here that will be in the slide deck that you'll receive afterwards that you can watch. But basically, you upload any materials that your team normally uses to review insurance claims and how to respond when there's a denial. And then it pairs that with a whole database of other resources and the government documentation. And then it'll very quickly spit out for you what the recommendations are. What are the next steps to overcome that denial? So it's pretty cool. We've got 10 hospitals using it already, and they're providing lots of feedback, and we're incorporating that. And again, the plan is to release this on GitHub in the next month, and everyone who's registered for the program will receive that information. But it'll be available for free for anyone on GitHub. Oh, thanks, Mariah. Thanks for sharing that in the chat. Okay. And then just to wrap up, I've got a number of resources here in the deck as well that you can peruse at your leisure. There's a lot of AI training here for you and your team. And then we also have a Rural Health Resiliency webinar series that we put together. We've had 2 sessions so far, and our next one is going to be on May 14th. So we invite you to register for that. And the link is here in the deck. And these are specifically tailored for rural health IT leaders. These topics were curated from questions that we receive around different tools that Microsoft has and how to use their cybersecurity capacity, because you may already be paying for things that you don't use or don't know how to use well or efficiently. So we've got some on specific products, and we also have some where we're inviting CIOs from different rural hospitals to talk about their experiences. For example, in July, there's someone from a critical access hospital who had a cyber attack on their hospital, and they learned some best practices and incident response that we'll be sharing. So invite you to join that. We also kind of kickstarted this grassroots rural health community, really because the director of this program, she's been working in rural health IT for over 30 years, and this has been a vision of hers for a long time. And so we partnered together with a couple of other organizations to start this nonprofit where it's just a forum for rural health IT leaders to connect, share solutions and best practices, innovate, provide feedback as to what other things private and public sector could do together to help support rural health. So it's completely free to join. You can send an email to that email there. We won't spam you or sell your information. This is just to connect folks in this space. And then finally, these are the key links for you. One is to register for this program where you can receive all the things I mentioned today. And another plug for the rural health community. But if you do have any questions or feedback, you can always reach out to the rural health team. So myself and Laura and Allie, there's 3 of us. And I'll also drop my direct email here in the chat. Feel free to reach out to me as well. So that is all of the prepared remarks, but I'm happy to address any other questions. Thanks so much.
Yeah, while we give a moment for people to ask their questions in the chat, I just wanted to thank you for taking the time to share this resource with us all. I know we'll have this recording posted as well, so for those of you joining us, feel free to share it with those that might be interested but weren't able to join as well. It'll be recorded and posted as well as the slide deck for all of these links. So thank you. And it doesn't look like we have any questions in the chat. So your email's there in case anybody has any follow-up. Is it okay for them to reach out to you directly with
Yeah, of
questions?
course. I'd love
Perfect.
to.
Okay. Well, thank you so much for your time, and thank you everyone for joining us. I hope you have a great rest of your day.
Thanks, Mariah. Appreciate it. Take care.